Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thanks for tuning in, and I'm glad you were here. Today, we're going to part two of the series that I began in last week's emotional podcast. I never knew if I would talk about that material online. It's very personal. It's very intimate, and but I think knowing the intent of the person is so important. You know, we're living through times of marketing and targeted advertising and curated messages where there's a lot of hidden agenda and there's a lot of hooks. It's like you don't know what they're going to hook you with. They want to sell you something and try to get something from you. Or there's an agenda in there that you're not quite aware of. And so I've come to the conclusion that, radical transparency is everything. Just being very clear with you, very honest with you, very open with you. Like, why am I like this? What is my goal in this? What's my agenda with you? What inspired me to want to be this person and to sit in this room with you and to have these conversations? And, I said it last episode and it still sits with me when I said, it's like a love letter to my younger self who had to navigate a time in his life where I didn't know what healthcare to use. It was a dangerous time in my life for my child's health. I had so much riding on it. And I found so many people having another agenda in there, not about my son's health. And it's so confusing. And then in the years after that, with my working with women, I keep seeing it being repeated in different ways, and I just feel like I found a purpose in my life in doing this, in my practice medically, and then doing this podcast is just another way of doing it, but even more pure for me because I can see myself doing this, and I don't charge for it. This is just me being me in this space with you. I don't have anyone paying me to do this at all. There's no, supplement company. There's no, no one. I have no bias or agenda in here other than I'm here for the feels. I'm here for the work. I'm the feeling that I get when I know that I've done something of benefit that's selfless. This is why I'm here. Today, I'm going to get a little bit more into the specifics of, the whole how did we get here with MAHA and Make America Healthy Again, and the wellness sphere that we have out there, and how traditional medicine or insurance-based medication has brought us to this place in America, but also managed care around the country, around the world. Actually, a lot of you have universal health care in your country, and it is in so many ways wonderful because you have health care, but a lot of you are suffering the same problems in the sense of you're not quite given good care or comprehensive care because there's a profit margin involved. So I'm going to kind of dive into how we've had this rising up of alternative types of medication, alternative types of medicine has been on the ascendance, which is what MAHA is in a lot of ways, and what led to it. So today I wanted to discuss how patients turn exclusively to one type of medicine, specifically in the sense of when people go exclusively into alternative medicine, something they found online, and why do they get there? And then when you practice medicine, you get different people coming in the door every day, different kinds of people. And that's part of the joy of doing this, is you get to meet all types. And one of the things, though, that I run across in clinic that is difficult is when a patient is so absolutist in what they will and will not do, and they come in preloaded that way. And let me be clear on this. Patient empowerment is everything. You're not going to be a good physician unless you sit down with your patient, spend time with them, understand their motivations, what they care about, what's important to them. You have to share common ground with them. You can't come into the space with the patient and say, you're going to do this. That is a failing method of practice. That just will not work. And it just can't work. That's not how life is. And but when you have a patient presenting into clinic and they start seeing you, yeah, I'm going to use cholesterol because that's just something I come across that has extreme opinions on it. You'll have patients that they will only do a statin drug. That's it. They'll come into clinic, they have a slight elevation in LDL cholesterol or triglycerides, but usually LDL. And I'll say to them, I think this is, diet. I could bring this down with fiber. I could do this whole protocol. I know what to do. Let's try this, because I want the benefit of the fiber, not just to lower LDL cholesterol, but because the fiber's got all these other benefits for colon health and just blood sugar metabolism. There's a lot of good things fiber does. And I want that for them. But they say, no, I just want a drug, and you get them. They don't want to do any of this hippie stuff. That's them. The other one is the patients who are saying, they'll come in, their cholesterol, their LDL is, remarkably high, not safe high, but remarkably high. And you'll say to them, this is a very high cholesterol. And I don't think this is safe. And I would like to lower it. But they will not touch a pharmaceutical. They will not let me prescribe a pharmaceutical. And I want you to know, again, I'll remind you, I'm a naturopathic medical doctor. I am qualified and trained in lifestyle and in prescribing. And I will use natural medicine first and foremost always. And even when I use a pharmaceutical, I will always do lifestyle along with that in the hopes that I will diminish or even remove the need for the pharmaceutical. But I need to stabilize the human being in front of me. That's my goal always as a physician. When I have a patient presents to clinic and their LDL cholesterol is, it should be optimally below 100. Healthy, normal, 100, 130, okay. 130 to 160 is borderline, 160 or higher is elevated as it goes on from there. But my point is, if someone comes in, their LDL cholesterol, instead of being like, optimal 100, they're coming at 180 or even 200 for the LDL cholesterol, not total cholesterol, but just LDL cholesterol. And I'm like, we probably need to do something to bring this down quickly. It's not safe. The patient would deny this because of their experiences online, what they've learned online. And they will say, no, I'm not going to do any statins. That's poison. And I'm going to just do this. Anything else. I'll do these herbs or I'll do this supplement. I'll do these things. 20 years in practice, I will tell you honestly, when your LDL is up that high, it's hard to bring it down with just fiber. I'm all in for fiber and fiber in your diet. I believe that's a great tool, but in all my years, I've not seen that work well enough when the number's very high. So then the thing I come across these patients is they're locked into this. They're locked into this dogma of, I will not take this pharmaceutical. I won't take a pharmaceutical. Why did they get there? How did this happen? Why is it that when I talk to them, they won't even let me discuss like the pros and cons and the ways that I can manage the statin? If I had to write a statin, I can use coenzyme Q10 to mitigate the risk of the mitochondrial dysfunction that occurs. Because if you take a statin drug is going to slow down your production of cholesterol. If you take just enough, you're going to get the LDL cholesterol into a healthier range. That's what I want. That's a good thing. The LDL in a healthy range is a good thing. But we never give them so much that it's going to cause them to have no cholesterol. We just want to give them just enough to get the right place. But a side effect of that is it's going to impact the ability for the mitochondria to make coenzyme Q10. So on my end as the physician, I'm like, okay, well, let me prescribe coenzyme Q10 to mitigate that deficiency that was created by the drug. On top of that, the patient comes in and says, well, my LDL cholesterol is high, but does that really mean I have a problem with my heart, my blood flow? Yeah, we'll do imaging. I'll do scans. I'll do CT scans of the heart. I will do carotid artery intimate thickness testing. I'll do all of these things, to verify that the LDL is at risk, the particulate count is high with an MR. I will test all of the work to show you the risk for this. Still, even with all that testing, they still will not use a prescribed medicine. Why? What happened? What caused them to think this way? That's the topic for today. The thing is, and I'm saying this in a constructive and caring way towards my friends who practice, insurance-based medical care. A lot of this came because of the dismissal rate of these patients for other conditions, for many other things. When a patient comes into clinic to see you and you're only allowed to have 15 minutes for them, for a complex case, they lose trust. They don't feel heard by you. They don't believe that you're going to be there for them because you physically can't be there for them because you're not going to be compensated for that. And whoever you're working for wants you in and out of that room. And I know it. I get it. And that's not what you all set out to do when you went out to medical school, I know. But this is where we are now. A huge percentage of the population is denying medical care because of these experiences they've had. When people are unwell, that brings on a tremendous amount of uncertainty. I remember the first time I saw my liver enzyme elevations being high. I was in a lab rotation. We were learning how to use the lab at the clinic, and it was in med school. And we did a, urinalysis, and I saw, it looked like something's going on with my liver. And I was like, what is this? I had a panic attack. I had anxiety. Freaked me out, Now as a physician, looking back, I'm like, dude, that's nothing. Don't worry about it. You stop eating gluten. That's what it was. And, but I had so much anxiety over it. When a patient sees something wrong in their health, you will feel anxious and worried because you don't know what's happening. That uncertainty is a big deal, and it's a loss of control that they've always felt that they had naturally occurring. Like blood pressure's high now. Well, that's uncertainty. That's a loss of control. So they felt they always had good cholesterol. People gaining weight, that's a loss of control. They always felt like their weight was under control. What is this? This is a very insecure thing for human beings. It just is. And if you deal with it every day in your clinic, people in and out your door all the times, you could become desensitized to them. It's something that you'll start seeing as being trivial, but to them, it's the world. And they are right. And if you can't see it, this might not be the right field for you. Because it's the human being in front of you that matters most. And validating that human being and seeing them in the moment. And that's empathy and care. That's what it means to be a physician, in my opinion. The reason why people migrate from Western or insurance-based medication or insurance-based providers and managed care is because the alternatives offer compelling stories and they validate where you do not. They spend the time to validate the patient and they give them more of a deeper understanding. And they do provide compelling stories. I mean, go online, look at these people. I had high cholesterol and I spent, 6 weeks eating grapefruits and my cholesterol's perfect. And they'll stage it and make it look awesome. They'll do the whole narrative. You know what I mean? They'll do the whole hero's journey with it, where they go off like all the ways you do the story. That's how these storytellers work online. They do, and I know this. And they create these compelling stories. And patients love that because they see that patient went from not knowing to knowing. They went from nothing over here, afraid, to empowerment here. And all it is eating grapefruits all the time. Blah, sign me up. It'll correct my cholesterol. And I'll feel this way. And that's what they do because they need that narrative. And you were in the room for 15 minutes. You can't give them that narrative. So that's when they go to someone that will, because as human beings, we're emotional creatures. We need comfort. We need care. And if you're not providing it, you lose the heart of the patient in front of you. You could stand out there all you want and argue that your medicine is stronger and better and will save lives till you're blue in the face. But until you can understand the person in front of you and show care, truly care, they're not going to follow you. And because of this, managed care and going with profit first, it has failed millions of people because they've lost faith in this. And now they go out here and they wander in the wilderness looking for someone to show them care. So when I see, MDs out there influencers, you know, trashing and tearing apart alternative medicine. Okay, I know. I see some of the stuff you say, and I get it. I get your biochemistry components, and I see you. I get you. But you're just bashing something out there, but you're not looking inside yourself and saying, how did we lose this? What did we do that caused people not to listen to us anymore? Where did we lose our patience? Where do we lose our people? You went to medical school, you did your residency, you did all the stuff you did to become the person you are because you wanted to help people. And now your people are not listening to you. This is a failing largely of the profit-based model. And even in those countries out there that have more of a social medicine approach, you're still managing care. You're still controlling costs. It just is. It's just a matter that your government's controlling the costs, And there's a certain level we should control costs. We shouldn't just be blowing money, for nothing. We should be spending money, and spending time, but we shouldn't be seeking profit, should we? I'm dead serious right now. And we should not be trying to save money. We should be trying to save lives and measuring our success in terms of health of the individual. So to sum this up, a fact of it is that when a person's not well, they seek agency. They seek a sense of understanding. They also seek someone who empathizes with them and cares for them and will stand by their side, hear them, and validate them. This is what the market demands if you're in a commercialized nation like mine. And if you're a social nation, the person wants to be seen as an individual human being. Gosh, it's universally that way. Okay, fine. We all want to be universally seen as human beings. And when we're more focused on our timelines, getting out of the room, we're not able to truly be in the room with them and care. And when we're being rushed from patient to patient to patient, sometimes we lose a sense of empathy and a sense of intimacy that goes with being a physician. I hope this helps. I truly do. Next episode, I'm going to go into medical understanding of patients, why patients have gaps in their medical literacy, so to speak. I'm going to discuss the role that the pharmaceutical industry has made in that. I'm going to discuss the role that the nutraceutical industry has made in that. I'm going to discuss the role that everyone plays in special interests, the lobbies for corn, the lobbies for sugar, how they've really messed with our understanding of health and why that lack of understanding has led us to this place where we are now, again, of complete distrust for the system that's in front of us. And my goal with this is not to bash Western medicine, not even remotely, or I keep calling Western medicine. I don't have a good name for it. Managed care. I keep coming up with different names for it, but it's just, yeah, managed care. I'll keep you saying that one until something else sticks. I'm not here to bash the providers. I'm here to bash the model. The model's not helping the providers. The providers are not doing well. They're not thriving in that environment. The patient's not thriving in this environment. You're causing problems with it. We should take it apart, truly, and go back to the most important thing. Not figure out payers. Okay, that is important too. But the important thing to me is get in that room with more time and care and make that work. Make that the business model now. How can I be better in that room with that person and be a better physician, a better provider, more patient-centered, not number-centered? And I hope this helps. I truly do. Like I said, this stuff is important to me to get it right, and I worry about it a lot because sometimes you only get one time to make a good first impression. To the degree I'm doing good, let me know. I do read the comments. Evelyn and I do read the comments, and please, if this is information that you value, please subscribe. And If this is a good episode, press like. And if you think someone will benefit from it, please share. And I'll see you at the next episode.